Hey everybody, this is the Standardized Patient Encounter overview for ATEP 365 Gen Med and Pharmacology. I just wanted to go over all the aspects of this in terms of making sure everyone understands the logistics, grading, and what to expect, since this is the first time for all of you in the class to do a Standardized Patient Encounter. What you are seeing on your screen right now is the schedule for December 3rd and December 5th. I've sent this out to everybody, and the people that have had issues before have told me, so this is the final schedule. Your class is in green. You'll notice that there are some helpers, Sam Hinojosa, Sam Weber, Nancy, Rebecca, and Zoe. So from this, the Nancy and Rebecca will be assisting with grading. Sam Hinojosa, Sam Weber, and Zoe will be assisting with logistics in terms of making sure you know where to go and where you're at during the Standardized Patient Encounter. Nancy and Rebecca have been trained in making sure that we are all evaluating the same way, so you shouldn't have any discrepancies depending on who has who. You'll want to also make it clear that there will be 2 rooms going on at the same time. So like for example, Nicole and Stephanie will be doing their individual encounters. You will not be in the same room together. You will have 30 minutes individually, one with me and the other one with Nancy. And during that, I will be in a room next door watching through video feed, live video feed, and grading you that way. So in the standardized or in the actual clinical exam room will just be you and the patient, will not be any of us, will not be another classmate, won't be anybody. So it'll be truly a encounter as you will be practicing as your own clinician in the future. So please review the schedule and make sure you understand where to go. I have asked you to come 5 minutes early to make sure everyone is there on time. So please be there at your time, and then you'll start at 5 minutes after that. So as an example, if it says 8:25, please be there at that time, and you'll start at 8:30 and have till 9. So outside of that, I've made a handy sheet to kind of go over all of the parts of this. I will replace this with a link to this video after I finish it and put it there for you. But the point of this video is a pre-brief to familiarize yourself with location and logistics to reduce your anxiety about this, review the rubrics and assessment plan, and a brief introduction to the case. So location and logistics, we will be at the clinical simulation lab at the College of Nursing, which is at 1601 Green Street. This is the College of Nursing Williams-Brice building. So this is the entrance off of Green Street. There's very limited parking in this area, so please be mindful about that. It may be easiest to walk and then just arrive and being sure you're on time, so you may want to time out the walk. Once you enter, there are these 4 brown rooms right here. These are the rooms we'll be in, but you may need to hang out in this little kind of hangout waiting area over here by the canteen. This is the best place to hang out before or after, and there's restrooms over here as well. Our helper, whoever is not grading that morning or that afternoon with you, will be over here to kind of help guide you and make sure, and they will come and grab you when it's time for your standardized patient encounter. So at no time should you walk into any of these rooms or into any classrooms. Please walk in, find the student helper, and then hang out in one of these areas. The standardized patients purpose of these is to create a safe room or a safe environment for learning, and it's not skill practice. So the point of this is an environment to develop and practice your interviewing, your physical exam skills, communication, but in a supportive and systematic environment. So the patients are actors, and if they have something, they'll have it, and if they're supposed to be there, it will be there. Don't ask them questions that you may want to know. So if you take someone's blood pressure and it comes out to something and you're like, is this really what it is? The answer is yes. So if you're supposed to see bruising, there'll be bruising. If they're supposed to be swelling, there'll be swelling. If their pulse is supposed to be rapid or slow or fast or whatever, it's supposed to be that way. And so they'll present that way. So if you see something, it's real. If it's not meant to be there, it's not meant to be there. So please assume that this patient is presenting just as like a normal patient, and you want to ask them, is that really what your blood pressure is underneath your breath? So be mindful of that while you're doing the encounter. So logistics of what to do during the encounter. So once we come and get you, on the door will be a presenting situation, which I'm going to show to you now. So the presenting situation, all of you will be seeing Jordan, a 52-year-old presenting for a general medical ailment. That's all you know. You're going to imagine that you're at the Black PE Center athletic training facility, which is where ROTC next to the classroom upstairs. So you're going to envision that yourself is in that area. And as that athletic training facility, we provide healthcare to the campus rec, club sports, all faculty and staff, and the community members. And this is true starting in January. So this is something that may be possible to happen for any of us working out of that clinic. You're going to be seeing Jordan, who is a first-time patient of yours. They are a walk-in, so they're a new patient, and they have scheduled to come in for an encounter with you, but they have not seen you before. So from that, you'll have 30 minutes to complete a focus history, physical exam, and discuss your findings. You'll also want to educate your patient relative to whatever your diagnosis is and the plan moving forward relative to interventions, including pharmacology. So please be mindful that you should be incorporating pharmacology into the encounter. So being mindful about some things that you may want to use. You can also assuming that they're coming back to you. You may also want to include other healthcare providers in your team. So during this, you're allowed to bring a notepad, bring anything that you would typically bring to a patient evaluation that you're doing. So if that's your laptop, notepad, something to write on, whatever that may be, you can do that. In the room, there will also be some instruments. So you'll have like a goniometer, reflex hammer, blood pressure cuff, the standard assessment tools. You also have some stuff relative to gen med. So you may have like a glucometer, stethoscope, things like that we have practiced this semester that you may need during the standardized patient encounter relative to the presenting situation. Now, just because stuff's in there doesn't mean you have to use it, but you are it is accessible to you if you need to use it depending on how the patient's presenting. So those things will be in the room for you already. So when you get there, this will be on the door. Your patient will already be in the room, so you'll knock and enter and begin the encounter. The goal of this is to practice your patient-centered care skills. It is not to be quick and efficient. It is to be thorough and to do a really good healthcare exam. In athletic training, typically we rush through things, a quick 5-minute or 2-minute exam even sometimes. The goal of this is to be fast. It's one-on-one, or not to be fast. The goal is one-on-one 30-minute encounter. You don't have to take the full 30 minutes, but you need to have been thorough. When I say thorough, it's important that you go back to the rubrics to see what we're assessing for. So from the instructor evaluation, we have this one, which is the skills checklist. The goal of this is to get a 3 or above on any of them. As long as you get that, you'll get full points. Anything that's a 1 or 2, you'll lose points on. So our things relative to communication, data gathering, patient education, and overall performance. That will be on Blackboard as well. We also have the SPET. The SPET tool is looking at the core competencies. For this, we want you to be at competent area, so providing patient-centered care, working on an interdisciplinary team, and employing evidence-based practice. As long as you get a 3 or a competent area, then you'll get full points. Anything below, you'll lose a little. Anything that you get above there, which is highly unlikely, but as proficient and expert are intended for practicing clinicians that have developed their skill over time. If you happen to score there, you will get extra credit. The last thing that you'll be assessed on is the patient. So the actual patient will do an evaluation on you. They've all been trained on how to complete this tool and what they are assessing for relative to how you should be doing the assessment. The goal here again is to get a 3 or above. Anything that is below you will lose points on, and they will also be writing feedback here and providing it back to you, which I think will be a nice thing to hear back from the patient about how your interaction was relative to the things that you did or did not do. Now, after you finish your standardized patient encounter, those are the things that add up, so that's 9% of your total grade. After you get done, immediately following, we ask that you leave the College of Nursing and don't hang out there to do this next part, but go somewhere else. And at that point, we ask that you do not talk about it before, during, or after with anybody from class, regardless if they have gone or not relative to the encounter. It is not fair and should not be discussed. Your next step is to document, and you only document what you found out. Don't document anything else. I have all the recordings of the videos, so if I know you documented something that didn't actually happen, it's probably likely that you discussed it. A disclosure of any of the case material to anybody outside of the actual one-on-one encounter will result in a 0 for this for cheating and plagiarism. Please do not discuss the case. I know people are tempted to want to know how it went, what did you do, stuff like that. Wait, we have a moment to do that. Don't talk about it. Please don't talk about it. So for this, we have a documentation form. Now this may look different than what you're used to. This is using best practices. This is a fillable PDF and will all be available to you on Blackboard. And these are things that you'll need to document. These are also going to be helpful for you to plan how you want to do your patient encounter relative to the things that you need to ask about during the encounter. Once that's done, we will have our debriefing session. This will be on Zoom, so it'll be like this, and we'll talk about it. That way everyone can just be from their home. You can join from coffee shops, wherever you want, just somewhere where you can attend, and everyone has to talk. I will have a checklist. If you do not talk, but you attend, you'll receive half of the points. As long as you talk at some point, I will call you out towards the end if you have not, but you have to talk at some point relative to one of the questions we have. A debrief is a safe place to talk, and this is when we will talk about the actual encounter and your performance. And this is a place not for judgment, to make sure that your classmates know that they're here to learn and everyone is supportive of each other. The debrief will be December 5th, which is Thursday at 7:30 p.m. Please work with your preceptors to help them to know that you have to go to this and it is required for class. So please be mindful to make sure to be on time to that on Thursday night. That is after everyone is done. So we won't do anything for the Tuesday night crew or the Tuesday morning crew. After you get done, we'll have to wait till Thursday. After the debrief is complete, you'll complete this online survey. It's a self-evaluation tool, very similar to the ones that you do for the primary care experience. Ask you open the link after the debrief gets done and complete this. Don't do it before the debrief because there's questions relative to the debrief on there. And it should take about 4 minutes to complete this tool, and that'll be 2% of your grade. The only thing that you actually have to submit on Blackboard is your SOAP note. The rest of this stuff I will upload as a grade, so I'll put all of these, I'll scan them all in, and then I will check off for those that went to the debrief, and we will look at your self-evaluation through Qualtrics. You won't need to submit anything there. So the only thing that you have to upload on Blackboard is your SOAP note. The goal of this entire encounter is for skill performance and get you confident in your skills and abilities. So please be mindful that this is an evaluative encounter, but it's not meant to create a stress. It's asking you to just perform patient care as you normally do without the comfort of a preceptor around, but with the comfort of knowing that it's okay to fail at this moment, that you're not going to hurt a patient, and if you make a wrong decision, it's okay. The goal of this is to not get the correct diagnosis. The goal of this is to provide patient-centered care and do a thorough medical exam using the information that you've learned this semester. If you happen to provide incorrect information, I will note that and give you feedback on it. But if you make a wrong diagnosis but a correct care plan based off that, all of that's okay. The goal of this is just to move forward with what you're thinking and your thought process, and to use the stuff from this semester in a thoughtful way. So if at any time you're unsure of what to do, look back at the checklist form that I've made, which is this one, and rewatch this video. Make sure you understand, arrive on time, and then be engaged in the encounter, and then complete the SOAP note. For the encounter, we do ask that you be dressed professionally. Please wear your name tag. Please be dressed in a polo and khakis like you would be going to clinical. So please be dressed in that attire and environment. If you have any other questions relative to the encounter, please let me know. I'll be happy to answer them for you. Thanks.